Welcome to Bridging the Gap, a short video series on specialty value-based care. I'm Sally Engelman, Vice President of Growth at Bridgepoint MD. Today, we'll be talking about addressing gaps in care with our co-founder and practicing otolaryngologist, Dr. Will Harrill. Dr. Harrill, what's a care gap and how can a physician or nurse practitioner or physician assistant identify them?
So a gap in care is when care is provided outside of the view of whoever the primary caregiver is for that patient. So for example, if a patient is referred to another physician, did they actually complete the care that was being referred? What happened during that care? Did the patient make the appointment in that care? We're assuming they did, and that's exactly what a care gap is. It's a lack of knowledge about what's happening to a particular condition that's being treated or within the pathway of that treatment of that condition.
Thank you. And from the point of view of a specialist, how does identifying and addressing care gaps affect their practice?
Well, it makes your patients have better outcomes. It makes them a safer patient to treat. For example, I had a patient just last week who came to see me for a surgical procedure that they would, as an elective surgical procedure for a condition that they wanted to have fixed. Perfect. It's in my scope of knowledge. It's in my skill set. We're looking at talking about recommending surgery because medical therapies failed. Everything's moving through the system fine. Then I look at their blood pressure and I'm like, well, why is your blood pressure so high? They blame me, of course, having a white coat on. So it's the white coat syndrome. But then when you push them a little bit more, you find out this particular patient has stopped taking his blood pressure medicine. Didn't think he needed it, hasn't seen their primary care physician for a while. And the blood pressure levels were high enough that it actually would have been a risk for undergoing anesthesia on the acute side, and certainly was a long-term risk of having a heart attack. And I asked him about his family history. Yep, he's got cardiac disease in his family history. So I identified a gap in care. Someone had put them on a blood pressure medication. The patient was not compliant. They were under my care for a separate condition. And as a part of my checklist before the patient took off to go down the surgical pathway, we identified a system failure. The patient's not taking their medication. We put them back in touch with their primary care doctor. As I said to them, you're not having any surgery till you've been on that medication for a month, and we've got documentation you have good blood pressure control. That is not only identifying a care gap, that is good quality medicine you're providing on behalf of that patient.
Thank you, Dr. Harrell. That makes a lot of sense. If you're interested in more insights on improving patient care in your specialty practice, please subscribe to our YouTube channel, Bridging the Gap. Thank you.